Hello everyone, this is Professor Sujata Sharma. I'm the president of Biofootprints, which is a society which is meant for science promotion. And today is October 29th, which is the World Psoriasis Day. And over here we have a very eminent speaker, Dr. Saurabh Bhatia, with us, who's a consultant and head of dermatology at the Felix hospitals in Noida. I welcome you, Dr. Saurabh, to Biofootprints.
Thank you, ma'am. It's always a lovely opportunity talking about skin disorders, particularly. And just to be on your channel, that's a very lovely opportunity. Thank you for calling me again.
Thank you so much. Now, let me introduce Dr. Saurabh before we get on with this presentation. Dr. Saurabh has done his MBBS, MD, and senior residency at AIIMS, New Delhi. And he's on the reviewer board for 6 international and national journals in skin disorders and management. And he's got various publications in the same field. Residency at his alma mater, that is AIIMS New Delhi, which happens to be my alma mater also, has made him realize the importance of patient counseling, allowing the patients to know more about their own diseases and working with them to solve their issues together as a team. Psoriasis is a skin disorder which was not treated earlier due to lack of knowledge amongst the general population regarding the disease and its impact, which further hampers the daily life of the patients who are suffering from this disease. So today, Dr. Saurabh is going to talk about the various aspects of understanding psoriasis so that it can be holistically managed with the patients and doctors treating the disease together as a team. So over to you, Dr. Saurabh.
Yeah, so psoriasis is an important disease to understand for the general population because if they don't know about it, usually they come after a very long period of suffering from this disease, and it creates a bit of an issue for the dermatologist to treat to that extent. So the main point of this talk is to let general population know what exactly is psoriasis and to take an early action when possible. So with this, I'll just switch on my PPT. I'll switch to our PPT and then I'll start my talk. Okay. Okay, so hello. I hope that you can now hear me clearly and you can actually see the PPT. So we'll discuss a bit about psoriasis, what it is, what you need to know, and what is its impact on daily life and what you can do about it. So these are two celebrities. One is Kim Kardashian and the other is Rashmi Desai. They both have come forward that they suffer from psoriasis. But I don't think so that before this PowerPoint presentation you had any idea. Because people tend to keep it a bit secretive and they don't talk much about it. And that is why patients suffering from psoriasis take a lot of time before they consult a dermatologist. And that in turn harms their problem or increases their problems in the long term. So let's talk and know more about psoriasis. Psoriasis is a chronic skin disease. It has an unpredictable course of remissions and relapses, and it is characterized by multiple red, scaly, itchy lesions. It has scalp, nail, and joint involvement, and the causes is usually genetic or a multifactorial cause, and we say unknown. Now, when we say unknown, or let's say your dermatologist say that there is no known cause of psoriasis, it doesn't mean that we don't know the cause. It is so many causes are described in books that it's tough to pinpoint one single cause on it. Okay. Now, what actually is psoriasis? It is estimated that 1% of world population suffers from psoriasis, and less than half of them require aggressive treatment. Any age or gender can be involved, and it usually worsens in winters. So right now we can see that the winter season is setting in. So people suffering from psoriasis will have an increase in disease activity. So they need to know how to take care of this transient seasonal exacerbation in disease activity. Now it is triggered by scratches or physical trauma, which is known as Cobner's phenomena. So whenever a patient who has psoriasis has any trauma to the skin, we usually see that a scaly patch develops on that area. So that is known as Cobner's phenomena. Now what essentially happens in psoriasis is that the epidermal turnover time, or let's say the time taken by the whole skin layers to form completely from the base and shed off, is roughly around 28 to 30 days. In psoriasis, this turnover is very shortened to 5 to 6 days, and the cells are not matured to be shed off easily, and they pile upon each other to form thick scales which are characteristic of psoriasis. Okay. Now, what actually happens? So, we see that psoriasis usually involves the pressure points because they are more prone to trauma. So, pressure points like elbows, knees are involved, and it involves the scalp where it extends more than the hairline. Okay, the nails are also involved. The nails become thickened. The nail have some pits on the plates, and also joint pain is very frequent association of psoriasis. Now on skin there are multiple scaly red lesions, usually in a symmetrical distribution. The scales are mildly itchy, silvery in color, and when the patient scratches the lesion, the scales increase. Scalp involvement is characterized by diffuse or localized scaling and redness, and usually patients complain of severe dandruff. So here we can see, if we can just switch to a laser pointer, yeah. So here we can see the nail involvement in the form of thickened nails. These are thickened nails. Nail ridging. You can see that there is a yellow part at the edge. That is because the nail plate has split from the bed, which is known as nail splitting or onycholysis. Now, majorly, the skin involvement is in the form of red scaly plaques or red scaly lesions involving the back, the knees, elbows, palms, which is known as palmoplantar psoriasis, or scalp psoriasis, where it extends the hairline, extends in more than the hairline. Now, other organs are very frequently involved in psoriasis. For example, the major risk is to the cardiovascular system. Your heart, your great vessels, or the aorta, or the major vessels of the heart are affected. There's around 1.7 to 1.6 times increase of heart attack, myocardial infarction. The metabolic syndrome or increased weight gain or obesity is around 1.7 times increased risk. Insulin resistance around 1.6. Other disorders like hypertension, dyslipidemia, kidney disease, non-alcoholic fatty liver disease are raised in patients of psoriasis. And psoriatic arthritis is roughly seen in about one third of psoriasis patients in one form or the other. It could be mild pain just in the joints or in the hand bones, or it could be a severe debilitating pain forcing the person not to carry on with their daily routine life. Now, this is just an overview of psoriasis, what actually it is, just a very brief point so that patients who have psoriasis know a bit about their disease, and patients who suspect that they might have psoriasis know how to go and get help. Now, can psoriasis be treated? Yes, there are multiple modalities available to treat psoriasis, and what drug or what modality is chosen by your doctor depends on the extent, severity, and the impact of psoriasis on your life. Now, coming to drugs, topicals like creams, shampoos, gels are all available. Oral treatment in the form of methotrexate, which is a game changer in my opinion in management of psoriasis. Apremilast, another new compound, not new. We have been working with apremilast for the last 7 to 8 years now. Cyclosporin, retinoids, injectables. Now, biologicals are a class of drugs which target a specific interleukin or cytokine. Now, let me tell you what cytokine is. These are mediators of inflammation. So, psoriasis is a chronic inflammatory disorder. That means it is characterized by inflammation and immune dysregulation. Now, biologicals are certain drugs which target these molecules and block their action and decrease the inflammatory activity in psoriasis. Okay, so just take care of this concept that biologicals are certain drugs which block the inflammatory pathway in psoriasis. Other modality is phototherapy, which is Puvasol, in which we use the UVA radiation. If we use it in a chamber, it's Puva. If we use it from the sun, it's Puvasol. Narrowband UVB, that is also a very safe phototherapy. The only problem is it requires a whole chamber or a handheld narrowband where an artificial source of ultraviolet B radiation is given to the skin to decrease the proliferation or decrease the multiplication of skin layers. Excimer laser works on a similar principle. Now let me show you some examples on how a patient improves on these kind of drugs. So here we can see that a patient was given methotrexate for 3 months, and we can see that the scaly plaques have decreased. Now psoriasis characteristically leaves behind a darker area of pigmentation when it resolves, and many of the times the patients are concerned that the disease is still there. No, it's not there. The disease has significantly reduced and it has left behind a dark patch here. So you can see the dark patches, all are the areas where they were scaled. And that is just post-inflammatory color changes. You don't have to worry. This is not psoriasis. It is a let's say a footprint of psoriasis. The psoriasis has gone from that area. It has just left a footprint, and with time it will also fade away. So we can see significant improvement on the psoriasis affecting the soles, that is on methotrexate for 3 months. Now with methotrexate, it is very important. It is a drug which is given weekly. It may be split to reduce the side effect. The doses have to be calculated and recorded. This is a very powerful and strong drug. It is very effective in psoriasis, but it has to be used in certain indications. So if a person who is suffering from psoriasis thinks that they are more suitable with methotrexate, they should have a good discussion with their dermatologist. When can we use methotrexate? When we cannot use? What are the side effects? What all things do we have to take care of while taking methotrexate? It is very important to have a good detailed discussion with your dermatologist so that a good plan on methotrexate has to be started. Okay. Now another new drug, which is apremilast, and we can see there's significant improvement over 12 weeks on apremilast. We can see the lesions nearly melting away, leaving behind post-inflammatory pigmentation. Okay. Here we can see similar there is involvement of the elbows, and which has resolved with just post-inflammatory pigmentation over the course of 20 weeks. Now as you can see from the duration, the treatment is often prolonged. This disease is not going to go anywhere in few weeks. It needs a proper management, a proper regimen. You need to understand what drug you are taking, how it's going to affect you, and so that whenever you start a treatment, you start after a good discussion with your dermatologist and with frequent follow-up so that we can tackle if any side effects come there. Now this is a similar improvement with narrowband. Now secukinumab is an example of a biologic. So as I said, biologicals work on a certain specific immune pathway. It blocks that pathway, and because of that the psoriasis is not able to exert its immunological effects. The only issue is their cost. Right now they're very costly. However, the cost is coming down with months and months of research, and as we in future, I totally expect it to be very cheap so that every person who requires these biologicals will get biologicals. There are multiple other biologicals, all target different immunological pathways like adalimumab, infliximab, etanercept, ustekinumab. All of these drugs are biologicals, and with that we can target specific immune pathways and improvement in psoriasis can be taken care. Now let's discuss in my opinion, one of the major aspects of psoriasis management, the impact of psoriasis on daily life. Judging by the economic impact, in USA, $35.2 billion is lost every year because of patients who are suffering from psoriasis. 35% of that are medical costs, 34% are lost due to absence of work, and 32% because the productivity is decreased. Increased impact is related to severity. Patients with more severe disease have a more impact on their life. 34-36% reported difficulty at work due to psoriasis, and around 1/6 of patients have been unemployed because of their disease. Now coming to the mental impact of psoriasis, 36.7% suffer from one of the other psychiatric disorders. The most common of them are anxiety, depression, and body cosmetic issues. 10% suffers from depression requiring medical management. Another study showed that as high as nearly 80% of patients suffer from one form of depression or other, and a similar percentage suffer from anxiety, and there is a negative correlation with social relationships. Patients are not able to be more socially active and make a good long-lasting social relationships. Studies have also pointed out increased self-harm ideations, and younger patients have more psychological comorbidities because they are more prone to get all those negative correlation social relationships. They are more outgoing. They don't want to get locked in one house because of psoriasis. So there's a severe psychological comorbidity on younger patients. Now, what are the social impacts of psoriasis? Now, in a study, it was found that this I'm talking about the healthy people. 39.4% of healthy people would refuse to shake hands with a person who is suffering from psoriasis. 32.3% would avoid and they would not let a person with psoriasis enter their homes. And 27.3% consider psoriasis as contagious, which is it spreads through skin to skin contact. Now, let me be very clear, psoriasis does not spread through skin to skin contact, it is not at all contagious. But because of these issues, it has led to a lot of stigma and it is further hampers the improvement a person with psoriasis can have in their life and further impacts psychologically. So 16.7%, as we have already mentioned, were unemployed because of disease. 59.3% had to be absent from work. 81% reported that they had to spend more than 10 hours every week only on taking care of their skin. Now, this extra 10 hours every week could be from their productive time, from their work time, or this time would have been easily spent with their family or at work. So we need to take care of patients as soon as possible so that they don't lose time as the disease progresses. 41% of patients reported that they preferred living alone if they had psoriasis so that they don't have to go out more and talk to other people and face rejection from their side. Now, these are some myths when I usually encounter patients who have psoriasis, and these are some of the myths that they say, and some of them are the myths which are actually not just limited to India. It is internationally. It is seen that there are a lot of myths circulating around patients with psoriasis. So, first myth is it is contagious. No, it is not contagious. It does not spread by skin to skin contact. It is just dry skin. No, it is not dry skin. It is a severe inflammatory disorder that impacts other organs like heart and joints. It has to be taken care of seriously. It is because of poor hygiene. It is not related to poor hygiene, can be completely cured. Now, this is an issue which I, I think every dermatologist faces when the patient with psoriasis comes to them that, doctor, is it curable? Now, the way I answer it that it is not curable because no disease is curable, but every disease is manageable. So, for example, if you have fever and it lasts for one week, then there is no guarantee that you will not get another fever in 2 months' time. You will get it. But now you know that you are more prone to develop fever, you will take care of all precautions. Similarly, if you are suffering from psoriasis, we are able to control the disease activity, but let's say during winters it exacerbates and it increases in intensity. So now you know you have psoriasis, you can take care of it. You can get help early, you can do all the things which can be done at home. Okay, you can take care of skin, you know what drugs you are on. So this kind of thinking, this kind of change in thinking will lead you to suffer less if you are suffering from psoriasis. Now, the opposite is also not true, that it cannot be ever cured. As I said, psoriasis is a highly unpredictable disease. It is characterized by multiple relapses, it is characterized by multiple remissions. So, we must be patient and calm, and we must know what is the severity of the psoriasis and how we are going to treat it. And in the treatment of psoriasis, you and your consulting dermatologist is a team who will make decisions together. Okay, it only affects adults. No, there's an entire subset of psoriasis which affects the pediatric population. It is same as eczema, not at all. Eczema is entirely different disorder and it is not at all same to psoriasis. Even at a molecular level, these two are different diseases. Stress causes it. Now, stress exacerbates psoriasis. Stress increases the severity of psoriasis, but stress is not the cause of it. So that doesn't mean that if you will not, so if you will decrease your stress or if you will manage your stress, it will definitely help you. But it is not the only factor. Okay, so it has a multifactorial disease. So the treatment has to be multifactorial. Now, hot water heals psoriasis. Not at all. Hot water may actually exacerbate. It dries out the skin. Dry skin sheds more scales. So, psoriasis will become more scaly. Okay, so hot water does not heal psoriasis. Scrubbing the scale improves. Not at all. Scrubbing the scales will increase scaling. Okay, which is one of the features of psoriasis. If you keep on scrubbing, the scales will fall off and there will be pinpoint bleeding. So many times patients come with pinpoint bleeding on psoriasis because they have scratched it too hard. Scrubbing the scales will not improve psoriasis. Change diet to cure psoriasis. As such, there are no dietary changes in psoriasis, but we need to do some kind of modifications because in alcohol and smoking have found to be increased psoriasis. So we need to limit them, stop it as it is. No increased fatty diets because of cardiovascular risk. There's a risk to heart in patients with psoriasis. So less oil, less ghee, less clarified butters, less oily food, less junk food. These all are advised to the patients. Okay, and multiple diet modifications are usually done because you're some kind of a systemic drug. So we need to take care of that. For example, methotrexate requires a good healthy liver to take care of it. So if you're on methotrexate, you need to take diet which does not damage your liver. So no alcohol again. Okay. Psoriasis causes difficulty in pregnancy. Not exactly. If your psoriasis is managed, you can very well get pregnant as any other person who does not have psoriasis, and your psoriasis might exacerbate or even improve during pregnancy. So it's very unpredictable. All you have to do is keep following up with your dermatologist so that we can take care of psoriasis during the patient's pregnancy. Psoriasis is only skin tip, not at all. I've told you that multiple systems are involved, and that includes heart, joint, nails, scalp, multiple other organs. Severity is same as surface area, not at all. More surface area does actually mean that psoriasis is severe, but even a small plaque, let's say a small plaque on the forehead is very severe, while a plaque 4 times its size over the back will be less severe to the patient because it is not visible. Okay. Plus, if a person has one plaque and joint involvement, that is much more severe than three plaques with no joint involvement. So I hope you're getting my drift that surface area is not the only marker for severity. Now, what can you do about it? Number one, if you think you have psoriasis, consult a qualified dermatologist. Have a discussion with them. Have a good question answer sessions. Write down your doubts on a piece of paper and discuss each and every doubt. Have a good discussion. What level of disease you have, what is the severity, what drug is the doctor putting you on. Now I can understand that multiple times the doctor doesn't have that much time to give it to you, but you can still have a good discussion. I usually spend half an hour with the patient to tell them what kind of disease they have and what drug I'm going to start them and what changes in skin and other organs I expect over how much time, so that they are somewhat relaxed. Clear all your doubts, misconceptions, queries. Take all kinds of advice from the doctor. Follow the drug prescription diligently. The drugs used to treat psoriasis are very important and strong drugs. You need to take them exactly as prescribed by the dermatologist. Report and manage any side effects. If you think you're suffering from any side effects from the drugs, contact your dermatologist and report it as soon as possible. And last and very important, understand that this is a difficult to predict disease. You have to be patient, be calm, and work with your dermatologist to manage your disease. Alright? Now, there are a few lifestyle changes that is usually prescribed or advised to the patient during psoriasis. Lifestyle changes are crucial. I advise them to consult a dietitian so that they can have a good, healthy, balanced diet. No alcohol, no smoking, no fatty foods. Maintain a healthy weight. Go for regular exercises. If you manage your body weight, the drugs act good. The psoriasis itself has decreased inflammatory activity. There are certain diets which have been shown to benefit in psoriasis, like a calorie-restricted diet, like a Mediterranean diet, which are rich in fish oils, nuts, berries, fruits. Now, these are those kind of diets which have somewhat decreased caloric intake. So, the inflammatory quotient or the ability for a diet to be more inflammatory is reduced in these kind of diets. Omega 3 fatty acid and vitamin D rich diets are also advised to patients with psoriasis. Now, just summarizing everything, if you have psoriasis or if a loved one or close one to you have psoriasis, first of all, do not worry. Consult a dermatologist. Be regular with treatment and follow advices given by the dermatologist to you. Take a healthy diet. Hand holding and care is important. I've told you that it is very stigmatizing disorder, and patient as far as 40% of the healthy individuals will not even touch a patient of psoriasis. So that is not done. spread correct knowledge about the disease. So I tell my patients that now, since you have the disease, help me in changing the social understanding of the disease. And whenever a person who gives you a wrong idea about psoriasis, you come to me, consult with me, I'll give you the correct advice, spread the knowledge, and let others also know that what is the correct aspect or the correct way to handle psoriasis. Okay, it is definitely not the end of the world. So with this, I would like to thank ma'am for giving me a good opportunity to talk about psoriasis, especially today, which is the World Psoriasis Day on October 29th. And if you have any issues, my IDs would be displayed. I think it's not visible because of the window, but I'll ask ma'am to include that in the description. And if you have any issues, any doubts, any clarification regarding psoriasis, feel free to write me an email and I'll reply back. Otherwise, you can meet me personally. I've given the address where I practice, so you can come and see me and we can have a good discussion about psoriasis. If any doubts, you can surely let me know. Thank you.
So that was such an informative talk, Dr. Saurabh, and I'm sure it's very, very useful to the people who are suffering from this disease, as well as their caregivers, and basically to all the general population. And it's been such a pleasure having you over here as part of Biofootprints, and that too on such an important day as the World Psoriasis Day. Thank you very much. And I'm so glad that you have shared your email, and I'm sure a lot of people are going to get in touch with you regarding the questions that they have. Thank you once again for coming, and we hope to have you over again and again. Thank you, Dr. Sir.
Thank you, ma'am. The pleasure is always mine. Thank you.